everybody, it's Christian Edwards with Capital Nutrition, Supplement Warehouse, bestpricenutrition.com, and today we are here with Dr. Paul, located out of Lisle, Illinois. Sorry, we were with Sammy Gammon last week, and he calls Illinois, so that kind of stuck in my head a little bit. And he is outside, and he is located at Northstar Integrated, about a block down from the Lisle Police Department, off of Maple. Or about 30?
We're like at Maple and 53. They call it Lincoln Avenue.
Lincoln Avenue? Yep, and that's kind of the main strip in Lisle that takes you from Lisle to Bolingbrook to Downers and all that jazz.
Yep.
So Dr. Paul has been my main, F&P and chiropractor for the last probably 2 years now. Mm-hmm. I see him about every Friday, and I'll say that before having regular chiropractic work done, you definitely notice the difference if you're doing something, if you're not doing something. And I can tell you, whenever I miss a week or so, I definitely notice it. And I have my appointment every Friday. And right now, after strenuous activity, working out, weightlifting, all that jazz, yada yada yada, sitting in the car, I'm definitely ready to come through and get readjusted again. So, Dr. Paul, what are the most common symptoms or signs that one may need to be adjusted weekly? So, basically, most of our audience, they probably don't see a chiropractor weekly. So what are some of the main benefits that one would yield from whenever they come to see you or to get adjusted?
I mean, that's a good question. I think a lot of people come for various reasons. However, most of it focuses on a couple different areas: neck, shoulders, low back, hips, and a lot of knee patients come through. So a lot of it comes from either sports, a lot of it either comes from accidents and or just general wear and tear from office work or working around the house or that kind of thing, causing pains, aches, discomforts, such like that. So
most people will go through their whole life and probably never be adjusted. I know my grandparents probably have never been to a chiropractor before, but that's in the Eisenhower days. So what would be some of the most, common signs or symptoms that one may experience to where, they may benefit from coming to see a chiropractor for weekly adjustments on a regular basis?
There's a lot of reasons people come in.
Or what would be some of the symptoms to where someone's saying, hey, I would benefit from this?
I would say the most common thing that drives people in is pains, aches, discomforts. Mm-hmm. And then on top of that rides like holistic health concepts where people are kind of dissatisfied with regular medicine and they want to have other alternatives, other options. And then they recognize our clinic does traditional chiropractic work, but also integrative holistic medicine approaches too, where we can offer labs, medications, and other nutritional products that can help overall type of scenarios.
Now, we see all these different rooms up here, so what other amenities does your office offer?
Oh man, we offer physical therapy services that focus on stretching, strengthening, range of motion, all actively assisted with therapists. We have passive therapies that stretch you out, increase the range of motion, chiropractic services, acupuncture, nutritional counseling, like I said, laboratory medications, imaging services like referrals to specialists in imaging things like MRIs, X-ray on site, blood draws on site. The list goes on.
So you actually offer the imaging services on site rather than having to go to an MD or physician and then have to refer you over to another appointment or another hospital or somebody. So this is kind of a one-stop shop.
It's one stop, and we offer basic primary care in the sense that 80% of your conditions we'll be able to handle in office. And then if you need a referral for immediate care, acute care, ER, specialty care, we can provide those referrals for you.
Okay. And right now, this whole year has kind of been, mainly focused on COVID and immune health. So what would some of the main primary benefits be from, being adjusted for one's immune health?
If you're looking for immune health adjustment services, all the spinal adjustments, focus on like helping release all sorts of feel-good chemicals that upregulate your immune system, your nervous system, anti-inflammatory chemicals that your body produces. So when you actually get adjusted, your body naturally releases all of those anti-pain, anti-inflammation, pro-immunity, pro-health chemicals that your body naturally makes anyway, that the adjustments,
So you're basically naturally upregulating what your body's own defense rather than prescribing something or an antibiotic or whatever else it may be to kind of help.
I mean, you can combine medicines if you need symptom control, but if you want to upregulate all your feel-good, immunity, pro-health, natural chemicals on the inside of you, the adjustments can help with that.
So the adjustments are basically just making all of your cylinders fire.
Exactly.
And then, so another thing, what with chiropractic work, how does that stimulate CNS function and brain health?
I mean, the central nervous system pretty much runs your whole body. So I don't remember the exact percentage, but over 90% of your central nervous system flows through the top neck vertebrae in your neck. And so on those upper cervical adjustments that we do routinely, you're getting that central nervous system reset on all the adjustments on the upper cervicals especially. So that's how you can modulate the central nervous system especially.
So that would eliminate, per se, like your everyday brain fog and assist with mental clarity and probably some episodic memory as well, I would assume.
It can help with all those things.
And what holistic vitamins, extracts, or natural remedies? You said that you're more into the holistic side. So, what all natural supplements do you typically recommend? What baseline supplementation do you recommend towards a majority of your patients and clients?
I mean, we specifically check patients and clients like individually for what they need. But if you want a general list of things that are pretty popular, your basic antioxidant formulations that are pro-health, anti-aging kind of thing. Your popular omega blends for cholesterol issues and general health with fatty acid metabolism, digestive enzymes, various supplements that help you break down, process, absorb, assimilate nutrients for digestion. Several anti-inflammatory herbal supplements and such to kind of knock down inflammation and pain for arthritis and other things like that. So, the list goes on, but those are some of the basics.
So we'd probably be speaking of ALA, alpha lipoic acid, which would be like your free radical scavenger, your resveratrol, which would also help with say your overall health, your anti-aging, which is also it also comes from your red wine extract, and then your turmeric, collagen peptides or bovine peptides from collagen. So we're kind of speaking of things of those natures, and like your omega-3, 6, 9s, and probably 7, along with like your primrose oil.
I mean, a lot of people's diets are really bad, so it just depends on where people are. If their diets are really bad, you can basically get the general things into them. If their diets are really good, then people are seeking peak performance kind of performance enhancement to get the most and best out of their lifestyle. So there's a wide range of people what they're looking for.
So you have your patients that need correctiveness, and then you have your patients that are looking to be as optimal as they could be.
Exactly.
Essentially.
Exactly.
So another thing, I've been coming here for a while, and you have different tables that you run. I've ran through. You have a decompressing table, or a decompression table.
Yeah.
Then you have your electrotherapy and your ruling table. Can you explain the main benefits of those three tables for, say, someone like myself or a high school athlete who's involved in an impact sport such as football, soccer, rugby? I don't see much of rugby anymore.
People play it. I see people who do it. I mean, we have certain active and passive therapies. The passive therapies that you're talking about is where tables and machines and other things are working on you while you're getting that service performed. For example, the intersegmental spinal traction table kind of rolls and pushes up on your spine. Our clientele is broken up into several segments. So like people that are more over the age of 50, your joints start stiffening up, locking up, arthritis setting in, so getting that increased range of motion, flexibility back into you. Or if you're talking about impact sports and stuff, your body might be beat up naturally already, so having some rolling action, extending the spine, getting you know, the lymph flow, the circulation flow, your nervous system flow better. We have heat and interferential current, which again gets your blood flow going. Gets you know, some anti-inflammatory signals going. We have ultrasound for large joints such as your shoulder and knees and hips for anti-inflammation. And like you were saying, the spinal decompression table is more geared for what's called radicular pain, where if you have nerve going down your arms or down your sciatic nerve, down your leg, that can kind of take the pressure off of those discs. That
is that kind of like a numbing, tingling pain that you would experience?
Yeah, numbing, tingling, weakness, all that kind of stuff from discs.
So if you're experiencing something of that nature, that would be probably one of the tables that somebody would that somebody would, you know, in an initial appointment, they would come in and, you know, you diagnose that that's one of their issues, and they would come into your office, and then they would, you know, run through, you know, the 1 or 2 beds, whichever beds that they specifically need themselves for their, you know, individual specific therapeutic needs.
We frequently see people with that.
And then the electrotherapy, you know, most bodybuilders and most weightlifters, they're, you know, very, you know, we've experienced those a lot, not experienced a lot, but we've seen those a lot lately pop up in popularity. You know, now they're kind of selling them on Amazon and all that other jazz. Can you explain what the main benefits of those would be?
I mean, first of all, I would be kind of careful with Amazon and all that, because a lot of that stuff coming from other countries isn't regulated, and
you don't know the strength of it.
You don't know what's going on, but they do make several electrotherapy machines. Ours has a lot of different settings. We gravitate towards interferential current. Interferential current is more of a like medium penetrating current for like restoration of circulation, lymphatic flow, you know, healing up muscle, healing up ligament damage. If you're going to get things like TENS units, we don't really have TENS machines here. Those are things you can buy online. Those are more superficial skin stimulators. So we use something called interferential current, which is more of a medium penetrator for muscles, ligaments, joints, tendons, things that can heal the area up faster, whether you have chronic issues or whether you have acute issues, like if you're chronically weightlifting or doing other things, that's more of an acute building up / injury.
And it's probably helping pull blood back into the area.
Yep, to heal it faster, yeah.
Okay.